Okay, so we are back. This is Senate Health and Welfare, and we're moving on to Bill H-462, which came to us as the miscellaneous Department of Health bill. And Katie, we have a new draft.
You do, yes. You have a strike all, draft 1.1.
Okay, good.
So Katie McGlynn, Office of Legislative Counsel for the record, and I've highlighted all the changes to maybe make this a little bit more straightforward. So if you remember, the first part of the bill is where we're updating the title of ADAP. So the first, I want to say 8 or 9 sections are sort of dedicated to that. There are a few changes in section 2 on page 2. This is language about the Vermont Prescription Drug Advisory Council. And the language previously had the Deputy Commissioner of ADAP as a member of this group. And now it will read a designee of the Division of Substance Use Program. So it won't be the Deputy Commissioner, it'll be a designee of the division. And that's one of the changes that I believe David walked you through a couple days ago. Similarly with subdivision CC in the membership, this has the appointing authority currently from the Deputy Commissioner of ADAP. And so now it would just be the person appointed by the Commissioner of Health. In section 3, we have sort of similar changes. So this again came from David, that under the direction of the Commissioner of Health, it had been the Deputy Commissioner of ADAP, but now it would read under the direction of the Commissioner of Health, the division shall review and approve all alcohol and drug programs developed and administered by any state agency or department. So not specifying who in the division. And then language referring to the Alcohol and Drug Abuse Council would be repealed, as it's my understanding that it doesn't exist anymore.
Okay.
And then I'm scrolling through, I don't think there are any other changes in this part of the bill, no. So that brings us to page 6, section 9. This is the drug disposal kiosks. And if you remember, I think it was yesterday,
yes, it was.
There was testimony on this particular program in drug disposal, and there was a conversation about in some situations, an on-site collection receptacle might not be feasible for the pharmacy to have on site. So there's a sentence added that if the physical dimensions of a pharmacy make on-site collection receptacle and on-site collection receptacle possible under state and federal law, a pharmacy shall provide a mail-back option for consumers.
You went with the word impossible.
Impossibility is a concept in contract law.
Okay.
Well, that's good to know. But this works then? Okay. And we haven't heard that it will hear from folks, I'm sure, but I think this is helpful.
Okay, that brings us to page 8. You added 2 new sections to this bill yesterday. The first is section 12, and this is the language that Lauren Hibbert provided to you with a little bit of cleanup to comply with our sort of the statutory manual. So you have a new subsection E, consultation with commissioner and boards, that reads in subdivision 1. If an assessment under this section addresses activities that would constitute the practice of medicine as defined in subdivision 1311(1) of this title, the office shall give written notice to the Commissioner of Health and any professional regulatory board or boards having jurisdiction over some or all of the regulated acts. The office shall include such notice, the office shall include with such notice a copy of the supporting information received from the requester pursuant to subsection B of this section, and the notice shall be given within 14 days after the receipt of the requester's supporting information. And then in subdivision 2, the office shall consult the commissioner and relevant board or boards with respect to the requester's assertions that under subsection B of this section, after consulting with the office on or before November 15th of the year preceding the next regular session of the General Assembly, The commissioner or relevant board or boards may file with the office any written commentary they wish the office to consider. Submitted commentary shall be amended to the office's final report or assessment filed with the General Assembly.
This is good, and this is what you, David, and Lauren Hibbert had discussed. Okay, thank you.
And then the last new section is section 13. This is the working group on services for individuals with eating disorders. So in subsection A, the group is being created, a working group on services for individuals with eating disorders to assess those services available to individuals with eating disorders in Vermont and make recommendations to the General Assembly as to how access for services might be improved. And then we have the membership, like Commissioner of Mental Health or designee who shall serve as chair, Commissioner of Health or designee, a representative appointed by Vermont Care Partners, a representative appointed by the Vermont State School Nurse Association, Nurses Association, a representative of the Vermont Colleges and Universities appointed by the Vermont Higher Education Council, a physician with relevant expertise appointed by the Vermont Medical Society, and a new subdivision 7, a representative appointed by the Vermont chapter of the American Nutrition Association. Same powers and duties that you saw yesterday to conduct an inventory of existing services in Vermont for individuals with eating disorders, and also to provide recommendations for expanding and improving existing services. In completing the duties, the group is to consult with individuals with lived experience with eating disorders, parents of individuals with eating disorders, medical or public health professionals with expertise in treatment and research related to eating disorders, and other relevant stakeholders. This group has the assistance of DMH, and a report is due February 1st, 2023. A written report to the committees of jurisdiction. And then we have the group having its first meeting by September 1. Majority of the membership constitutes a quorum, and it ceases to exist February 1, 2023 when the report is due. And then the effective dates have been renumbered to account for the new sections.
All right, good, thank you. Questions for Katie? Mr. Englander, do you want to comment on what we have here?
The department supports all of the amendments proposed.
Okay, good, thank you. All right. So then the question is, committee, how are you feeling? You okay with this one? Good. Oh, lovely. Terrific. So I'm looking, do we want to vote on this one? Is this ready for that? I think it is. So, and our clerk is here. And so the clerk, who would like to fill this out on behalf of the clerk?
Can I just ask a question about the unused prescription drug disposal program? And do we clarify who's responsible for paying for that?
The pharmacies.
The pharmacy. Okay. And does that include the independent pharmacies?
Ask her, say, ask.
No, this is just the ones that we heard from yesterday.
10 or more establishments in the
Yeah.
United States. I move passage of H462 draft 1.1. Is that?
Yeah, it'll continue. to
Wait,
go on.
oh yeah, oh, I'm looking at the wrong thing. Phew. Okay, 1.1, you're right. Is that right? Will it be the same one?
It will be. I just took the highlighting off it, and it's sending it to Erin now.
All right. All right, discussion on this one? So Senator Terenzini, do you want to call the roll so that Senator Hooker can mark it down on the official form?
Certainly, sure.
Okay,
All right, Senator Terenzini is a yes. Senator Hooker,
Yes.
Senator Cummings,
yes.
Senator Hardy,
Yes.
Senator Lyons,
Yes, terrific.
5-0-0.
So I'm going to ask, I know that each one of us may feel some attachment to different sections of the bill, but Senator Terenzini, would you be interested in reporting this bill?
I certainly can if no one else wants to do it, or I'm happy to do it. So
All right. Is that okay with everybody? With the,
Sure.
Good. All right, good. So that'll be up, that'll go out today. Somehow, you can ask a friend to help deliver the final product. This is a strike all amendment, right, Katie?
It is, yep.
So you could have maybe
Is it-
someone on your behalf deliver it to the secretary's office.
is it permissible to ask Aaron to do it for us?
I think a senator, I think the reporter has to do it. We haven't run into this conflict before. So I'm gonna ask Senator Hooker or Senator Hardy. Okay. Senator Hooker has volunteered to do it on your behalf, and we'll see how far that gets us.
Senator Brock got away with delivering one for me, an amendment.
Okay.
Senator Brock can pass for me, Cheryl can pass for Senator Terrence.
That'll be good. So that's.
He said he did have to alter his voice a little.
Okay. So you just have to wear glasses. Okay.
Glasses.
All right.
And Katie, you'll send me the breakdown.
The bill.
The section.
Oh, you would like a section by section. Okay, I will get on top of that.
Thank you.
Excellent. All right, this is a good place to be. So this will be on notice for tomorrow and then up for a second read as early as Tuesday, but one never knows with what the calendar's gonna look like.
Good to go.
All right, excellent. All right, let's move on to 728. Is that where we are?
I believe so. Another strike all
It's making
amendment.
me feel good that I am not the only one that is.
It's Tuesday, no, Thursday. But I just want to say, first of all, before we go ahead, I just want to say that I was invited in to testify on a bill that Senator Hooker is going to be reporting this, H720, yesterday in appropriations. And to be honest, I had looked at the bill forever. And so it was a difficult lift. And then also to testify on H711, which is the bill I'm reporting on. But Katie, thank you, because you remembered all the little details that I didn't have on my
Phoning a
fingertips.
friend.
I forgot the county issue, so that's why we have the assistant judges in there. It's just like, yeah, I appreciated that a lot. We don't say thank you to our ledge councils enough for the little things they can do. I really do appreciate it.
For our staff.
Or our
I went
staff.
in yesterday and Faith has been giving me a printed agenda so I can use my screen. Here I zoom in and I can chat with Faith as she says, so-and-so has to leave in 10 minutes. So I've got all of this going. Yesterday I came in and she's been printing the agenda, so I have a hard copy. There were 2 different printed agendas by the time I got there because things had to be moved.
Modifying it, I know.
Okay.
Aaron does the same thing on a daily basis.
Oh.
So let's move on to 728. I know that there will be some uncomfortable unhappiness with the new draft. I just want to say that I did listen to the committee wanting to go forward with the safe injection site, and listening to people outside of the room and knowing where we are time-wise and the amount of testimony that we should take in order to move something like that forward, you'll see that it's reverted to a study again. But and I know that Senator Hardy loves studies and working groups.
Especially on things that we've studied 3 times.
But the big question really is, what is going to be the position of the federal government? Because that's what killed us last time.
Yeah, it is.
They're
It's-
still gonna say, we're sorry, but if you do this, Howard, we're going to confiscate all your property.
We can't afford it. But so,
So we'll lose a, major health mental health care provider.
Katie, what have we got? Is this a strike off?
This is a strike all,
Okay.
draft 1.1, and the changes are highlighted, so I can just bring you to the changes if that's useful, or maybe I'll just do a high level to
Do a
refresh
high
your
level and
memory.
then, yeah, I
Okay.
think so, please.
So, yes, but they're mostly towards the end of the draft. So section 1, these are the definitions of drug paraphernalia and organized community needle-based exchange program. This hasn't changed, but just to refresh your memory, this is by sort of removing some of the groups that have to operate this program. It expands the potential entities that can provide services. And then in section 2, there's a corresponding report that has to do with the Department of Health's operating guidelines for needle exchange programs. Sections 3 and 4 address prior and 5, and 7. 5 and 6 were deleted. So prior deals with prior authorization of MAT for Medicaid beneficiaries. So section 3 codifies the current practice with regard to MAT for Medicaid beneficiaries. Section 4 is a report and requires the Drug Utilization Review Board and the Clinical Utilization Review Board to weigh in and provide recommendations to DEVA, and then DEVA submits a final report to the General Assembly. And then section 7 is,
Can I ask two things? First of all, can you just remind me, maybe you, I guess, Katie, was this the one that did they come in and say, they came in and said that this was like an agreement that they would do this report and they were all okay with it? Do you remember this? Did DEVA come in and they had worked out an agreement that this report was I'm trying to remember, because there were so many reports in this bill that I can't remember which
On
one.
the
MAT.
MAT,
I believe DEVA said that they were okay with the MAT sections. in
yeah, I
this
think
bill.
they're okay with the MAT. I don't remember a report.
And then can you remind me, Katie, what was 5 and 6 that got deleted?
That was on the House side that they got
Yeah.
deleted.
Oh, that's on the House
Yeah.
side, okay.
And I've kept the numbering so that when you go to compare the two bills, we, are actually comparing the same sections.
Got it.
But that was going ahead with having parity between the no prior authorization for MAT for people who have private health insurance, people who use Medicaid. And it was deleted because after it was voted out of House Human Services, DEVA came back with the fiscal impact, and it was more than was anticipated.
Got it, okay, thank you.
Section 7 report, this is the report that had sort of sunset, had been going on for 2 or 3 years, and now it continues it for another 2 or 3 years, another 3 years. And then that brings us to section 8, the overdose prevention site working group. So to refresh your memory, this creates a group to identify the feasibility and liability of implementing an overdose prevention site in Vermont, sites plural. The membership includes the Commissioner of Health, Public Safety, a representative appointed by the state's attorney's offices, 2 representatives appointed by the Vermont League of Cities and Towns from different regions of the state, 2 individuals with lived experience of opioid use disorder, including at least one of whom is in recovery, 1 member appointed by Howard Center Safe Recovery, and 1 member appointed by the Vermont Association of Mental Health and Addiction Recovery. The program director from the Consortium on Substance Use, the program director from Howard Center's Safe Recovery Program, the primary care prescriber with experience providing MAT within the hub and spoke model appointed by the clinical director of ADAP, and an emergency department physician appointed by the Vermont Medical Society.
2 questions on that. Is the Consortium on Substance Use, is that the one in southern Vermont? Does anybody remember that was working on potential safe use site?
Where are you, Senator, I got interrupted.
Line 12,
Okay.
page 6, paragraph 6.
Okay.
The program director from the Consortium on Substance Use. Remember, there were 2 programs, Howard Center and another one that I think is in the Brattleboro area. had been working on substance use.
I don't.
Safe use sites, substance
David, do
use
you have a
sites.
clue about that one?
Yeah, I guess it doesn't really matter. I guess I'm just wondering who they are. And then my second question, Katie, and I think I might actually know the answer to this. This uses the term
You're
ADAP.
gonna ask that question, yeah, because, four
Hasn't changed
sixty-two
yet.
hasn't changed, we'll keep it as ADAP. Yeah, we're dealing with that in a few places, but, and this is in session law, so it feels,
It'll go away.
it will, yeah, I mean, it's not in the green book, so or
I
have to
would
be
have
updated.
asked that had we not just done that bill. It wouldn't have occurred to me.
Good catch.
Okay, so powers and duties. The group is to conduct an inventory of overdose prevention sites nationally, identify the feasibility and liability of both publicly funded and privately funded overdose prevention sites, make recommendations on municipal and local actions necessary to implement overdose prevention sites, make recommendations on executive and legislative actions necessary to implement overdose prevention sites, if any. And lastly, a new subdivision 5, develop a plan for the design, facility fit up and implementation of one or more overdose prevention sites in Vermont.
Do we want to say anything about budget costs associated with this?
And do you think, I mean, it's sort of vaguely in there, but do we need to say anything about liability and what recommendations on liability and recommendations?
It does say liability under number 2.
Yeah,
Feasibility
Feasibility
and
and liability,
It's in the
okay.
lead in
And then
language
put
too.
the,
Is it, okay,
and then
It's of A.
both publicly funded and privately funded. So the implication is for funding, but maybe we should say directly
Including,
funding,
let me think about this.
needed funding.
Identify the feasibility and liability of both publicly funded and privately funded overdose prevention sites, including costs for establishing such sites.
you could just say identify the feasibility, liability, and cost of both publicly.
That works too.
And then the other, I mean, I'm trying to remember the barriers that we identified. One is liability, one was the federal decisions. Do you think there needs to be any reference to federal, or is that
I
implied
guess
as
I was
well?
assuming it would come in under feasibility, then that would be something they would look at. I mean, if it's something, there's no reason not to specifically reference it.
I just, what, if we have to do a report, which you all know I don't like, that I want the report to be like extremely helpful, like you can take the report and then
Go to work.
go to work and not
Yeah.
take, you not have a report that's like
No,
waxing
that won't
philosophy, philosophilophically, I want it to be an action
we don't want
plan.
any philosophy.
I don't want philosophy, I want action.
Okay, we'll go for action. How will you say that, Senator?
I don't know.
Make this an action report.
Yeah, and, yeah, let me see.
That the
Recommend-
plan should be actionable.
yeah.
This should
Develop
be
an
actionable.
actionable plan.
Yeah.
Develop an actionable plan for the
Yeah, ooh,
design.
I like that.
There we go, actionable
Thank
plan. Okay.
I love you guys, thank you. And we haven't gotten to this part yet, but can we move up the date from, I mean, it's a year and a half away. That's
Oh.
so far away, November 15th, 2023.
Let's go to January 15th, 2023.
22.
January.
Oh,
We're in 2022.
Oh, I'm
We
sorry.
We
provide
could go back in
everything.
time and that would be even better, Katie, I like how you're thinking.
Okay, January 15, 2023, sorry about
Yes.
that.
Well, you know,
Especially given that they've
let's
already done 2
Let's think
reports.
about it,
They
let's
can
think
just
about it.
do cut and paste.
Well, all these people get together, yeah. Who's calling the first meeting?
The Commissioner of Health.
Is there
will
anything
designate-
about a first meeting being called no later than?
Yeah, September 15th, 2022.
Yeah, so
Would you like to move that up?
they're gonna move that,
You could say July.
yeah.
July 15th. We know that we can work fast in a crisis. We've done it over the last 2 years. This is a crisis. We need to work faster. I am.
Okay, and then for the working group, the working group shall cease to exist. That will again be January 15th.
Yep.
Okay.
Thank you for flagging that. Okay.
On the mobile MAT.
And then, so I'm scrolling down, I'm now on page 8. These were 3 pilot programs, and now they're 3 program presentations. So first in section 9, mobile MAT, excuse me, by February 15th, 2023, the DAs operating mobile MAT services shall present information regarding their services to the committees of jurisdiction. The Department of Health's ADAP division shall also present its assessment as to the efficacy of mobile MAT services at preventing overdose deaths.
I see you, Madam Chair.
What would you like to say, Senator?
In all of these were all, I think, they had money in
They
them
did.
before, and we took out the money because Department of Health
Because
said they didn't need it. I'm looking at David. But because there's federal funding. So I'm wondering if we can put a reference in here to the fact that they said they had federal money and that they need to report on the use of that federal money and who so that we're
Good.
sure they spent the federal money
Good. I like that.
in each of the cases, because
That's part of the presentation that we're going to get.
they otherwise, you know,
Yes.
I think there's a little concern out in the field
That is not gonna happen.
that it's not gonna happen, that it's not enough, that it's, and I just, you know, I mean, we heard yesterday from your person, Ann, that, you know, there was a little concern that
Yes.
the federal money was not sufficient or that it wouldn't be available in the way that they had hoped, and things like that, so.
Okay. Sounds good.
Thank you.
Mr. Englander, did you want to comment?
If I may. For the record, I'm David Englander, I'm the Senior Policy and Legal Advisor, Commissioner of Health. And I understand what the committee is on this bill, so I don't want to belabor the point. But there are reasons other than financial that the department is concerned with several provisions, both in what passed the House as well as what the committee has before it at this time. I think if I may, I'll primarily speak to section, I think what is now section 1. and
Well,
that-
hold off,
Oh, oh, I'm
hold
sorry.
on, all I wanted to know was about that one comment.
Oh, I apologize.
Yeah, so we'll pick up the rest in just a minute. I'll have you go through the whole.
Okay, so I'll just sit here quietly now.
So just about the money,
For now, That's fine.
Oh, yes.
Yes.
The question is, can we report on how the money is being spent and has been spent? Yes.
Okay. That is the right answer, thank you.
So this last sentence reads, the Department of Health's ADAP shall also present a summary of its use of federal funds for mobile medication assisted treatment and an assessment as to the efficacy of mobile medication assisted treatment services at preventing overdose deaths. Maybe I should put services here.
Okay.
So a summary of its use of federal funds for mobile MAT services and an assessment as to the efficacy of mobile MAT services at preventing overdose death.
Yes.
There was still, I guess it doesn't have to be in this bill, but, because it's in the budget, there was still $100,000 that was in this bill. And that seems to have gotten taken out.
It's gone.
Because it did stay in the budget, but there was, of the 880,000, there was $100,000 that stayed in the budget for something, and I think it was the mobile MAT.
It probably is, yeah, and that'll, this will have to go by Rule 31 anyway, so we'll see what happens there.
Okay.
Yeah.
Okay.
Okay.
Section 10, the Departments of Health and of Correction shall continue existing efforts to support access to MAT to individuals in the custody of the Department of Corrections and those individuals transitioning out of the custody of the Department of Corrections. On or before February 15th, 2023, the department shall jointly present information regarding the provision of MAT services to justice-involved individuals to the two committees of, or to Human Services and Health and Welfare. I don't know, should you put corrections and institutions in there? Or judiciary?
Probably judiciary would like it on our side. Anyway. And this also is the language about federal money. Did you put that in this?
No, it is not in here.
This also had money. They said they had federal money. You hear me taking deep breaths, Madam Chair.
Good for you. So here's what I suggest. Katie, how much more do you have to do? I'm gonna suggest that, since we've been through the bill, why don't we bring David up and,
There's
We
one
have another
section.
section left.
oh, okay, I was ahead. It's my fault. Go to section 11.
Section 11, the AHS shall continue existing efforts to provide or facilitate connections to substance use treatment, recovery, or harm reduction services at the time of an emergency response to an overdose on or before February 15th, 2023. The agency shall present information regarding the status of this work to the Human Services and Health and Welfare.
And did this one also have money? I just want that money language in all of it.
Okay.
Just to hold them accountable.
So that'll be something that David can comment on.
Yeah, why don't I move out of the way, let David do that, and I'll make those changes. Do you think you're ready for this to go through the editors the last time?
Yeah. And if I get up and leave in the middle of your discussion, it is because I need to be somewhere else and it has nothing to do with the presenter or the information.
So you say.
If you
Senator Lyons, are we gonna vote on this bill this morning?
We may, if we get a clean copy from Katie, we may well do that.
I guess I should have asked, are you gonna be here for the vote?
Oh, I'm definitely gonna vote. Don't you worry.
I know you just said you were leaving, so.
I'm just going down the hall to economic development, but if I'm back, I'll be back. Who knows how long that'll take.
If we
Understood.
vote, or do you want to just hold it open?
You can just hold it open for me, depending, if you make any grand changes, then I will veto, I will veto.
You wait, as soon as you leave, man.
One in there.
Okay. Welcome.
Good morning. My name is David Englander. I'm Senior Policy and Legal Advisor to Commissioner of Health. I apologize earlier for jumping the gun. The committee has heard from Kelly Doherty, the Deputy Commissioner, on this bill. I don't want to waste the committee's time. So my thought is maybe I would just briefly voice a few things. Is that, I don't want to use each other's time well. Section 1 proposes eliminating the requirement that a needle exchange be an AIDS organization, a substance use provider, or a licensed healthcare facility. Let me slow down. God, it's nice to be here. It's a beautiful day.
Yes, it's not so.
It eliminates the requirement that there be an AIDS service organization, a substance treatment provider, or a licensed healthcare provider. These requirements are something that the department continues to support being in the law. These requirements serve as a good proxy for an organization's capacity to undertake being a needle exchange. More than once, we've had fairly sophisticated actors come in and want to be a needle exchange, and then things are falling apart once they try to operationalize it. I'm just gonna be, I guess, as I said, I was gonna be honest yesterday, I'm gonna be honest again today. The elimination of this provision will likely not result, will likely only result in there being more work on the part of the department, but there not being any more service providers, because we still need to ensure the organizational capacity to do the work. It's also important to say that there's a finite amount of money available. So this will make more people vying for more pots of money. We do have statewide distribution of needle exchange, whether they be hubs or whether they be mobile across Vermont. So I just want that on the record.
Can I ask a question about that?
So, that was well stated and I understand it more now, but, is there language that you would, could suggest that would expand? So I don't know, I don't want to speak for the House, but I'm assuming that they wanted to expand the availability of needle exchange programs. Does the department have an idea for doing that without the problems that you just cited?
So when I sat down with the folks who actually, the social workers who actually do this work in the Department of Health, every one of them said, this is working as is. We understand that everybody's not happy. I mean, everybody in the community, everybody, understandably, people want more access and they want more money. But the very clear indication from the program folks that are on the ground say this is working as is. So the answer to your question is no, we don't have a recommendation because we believe that it makes sense as it is presently.
Okay.
Keep going. I may come back in before it down.
So the language that's being eliminated is limited.
I'm sorry.
The language that's being eliminated is limiting. And you're suggesting that we could, that language, put that language back in to do just that.
Yes, to keep status quo in terms of this.
Oh, sorry. Are you
Okay, no, I was just gonna say, because I mean, we heard from other groups that, there's a need to increase. So how do we do that and not sort of bypass the 8 service organizations
So
as well as opening it up?
and when folks have come to us and said we would like to be able to do this, we say, great, but you need to show that organizational capacity by meeting these other criteria.
the waste management and hazardous waste, those specifically, or are there other provisions that you're saying that they're having a hard time? I'm sorry, Anna, I did see you.
No.
By being an aid service organization or a provider.
Okay. Or a licensed healthcare provider.
Or licensed
Yeah, I see. Senator Cummings.
No, I just wanted to clarify what I thought I heard you say. It's not that I can just go up, put up a box and say, I'm a needle exchange place. I have to get permission from the Department of Health to be a needle exchange place. You're saying to do this and to do it safely requires a certain staffing, expertise, ability to organize some financial resources that the formerly named groups have, just probably by their size. So that opening it up to anybody will likely result in more work for you to look at all of these and reject them for the good reasons stated. And probably won't result in any significant increase in availability. Okay.
I did not and could not have said it better.
Okay, why don't we continue on with David and we'll come back to this.
You just speak them.
So I'm sorry, I'm just gonna.
Go ahead, yeah, go ahead.
Yeah, no, just flipping down to make sure I have the right bill. Yes,
He's been in this room too long.
There's a lot of diversity, so overdose prevention site working group, there's a lot of diversity of opinion on this. The Department of Health, opined on, I think on Thursday that there is a report that was produced in 2018 that there's currently a staff group in Burlington a subcommittee working on this issue now.
Yeah.
These groups don't come without significant resource costs. I'm not talking about money. I'm talking about when you have to find and wrangle and put folks in a room, and then you have to provide administrative and legal support. I'm saying this as a general matter. It takes much more effort than might be apparent. There's many hours that are put into putting those things together. So I just want to say that. I do want to say that the department does not support, at this time, based on the evidence, we don't support having an overdose prevention site. I understand that people feel differently about that, but I do want to be clear on the department's position.
That was not clear from the testimony received last week. We at least I was given the impression that the department would support it.
I agree with you, Senator. It was not clear, is why I'm providing clarity now.
Yeah. I do have suggested language, but we can wait till after we finish here.
You're in charge.
Oh, I'm on?
Yes.
Okay, go ahead. Mr. Englander.
I think, and concerning the new sections 9, 10, 11, I think these are things that we can all do. You heard from us on on ongoing efforts, and if you want to hear more detail, we're happy to provide.
Excellent. Any other questions for Mr. Englander? Okay, thank you. I might offer one suggestion on your point of these working groups take a lot of resources. I agree. That's one of the reasons why I push back on them a lot. And you're right that there's been a lot of things done already. Is there language in the KD that references the other groups that have other reports?
No.
Maybe we could add language that references the other reports and say, draw from the recommendations of the other reports and groups. So it's clear that, like I said, the cut and paste, we're okay with that. As long as they create an actionable report and plan. Do we use the word plan? That's what I would like, actually. Actionable.
Yes, actionable plan.
Yeah.
In the new sub 5. Can we put something in, short of specifically citing each report, which we could do, but it'll take me some time to pull the sites.
Yeah.
If you want something a little bit faster, we can stay in section 8. Let's see. There's created this group to identify the feasibility and liability, and maybe something referring to previous work on this topic or previous reports completed on this topic.
Yeah, previous reports at existing organizations or existing entities, existing efforts, or current efforts, because there is already the one you referenced in Burlington that's working on this.
Yeah.
So, something like that. So just to.
Katie, do you want to come up here or are you good over there? Whoever you
I'm
want.
good. I already sent the draft to the editors.
Oh, sorry.
No, that's okay.
Is it time to take a little break while that happens? But
I won't have anything for you to vote on, but if you, I don't know where you are in your conversation, but it'll probably be a few minutes before there's a document ready to vote on.
Okay, so do you want to, committee, do you want to take a break? Are we at a good place to do that? Let's do that. And then I'm going to be down the hall now. It's now at 11:30.